Hi, my name's Alyssa Pemberton. I'm a midwife and international board certified lactation consultant. This short video tutorial will show you some different breastfeeding positions that you can use with your newborn and how you can apply the same principles to any position you feed in to ensure that we're facilitating your baby to feed effectively and also ensure that feeding is comfortable for you. When you position your baby to feed, there are 4 key things to think about, regardless of what position you're using. The way that I'm holding this baby right now is what's called the cradle hold, using the same arm as the breast that you're feeding on and supporting baby across their back and their shoulder blades. Many mums find in the first few weeks of breastfeeding that the cross cradle hold is comfortable for them and also gives them really good control over their baby. The cross cradle hold uses the opposite arm to breast, and you position your fingers and thumb around across your top of your baby's shoulders and around their neck to support the weight of their head. The rest of your hand and your wrist are putting pressure on the baby's back to hold them firmly and closely to you. Some mums also find the rugby hold or the football hold is quite useful, particularly for a baby who's struggling to latch. This is achieved by placing baby under your arm, facing towards your body, and supporting behind the neck and shoulder blades with finger and thumb. When using any of these positions for breastfeeding, what you want to remember is the acronym CHIN, C-H-I-N. You want to have your baby close. The closer you hold your baby, the more breast they'll be able to reach, and the more secure they'll feel and be able to relax the muscles of their head and neck to tilt their head back and latch on effectively. So bring your baby into the breast facing directly towards you. Encourage that lower arm to come round and give you a hug, rather than being trapped in front of their body and between the two of you, creating space. So get that arm to give you a hug, turn them directly in towards you and hold them nice and close. We want to make sure their head is free, and their head should be able to tip back when they're feeding, so that when your baby comes to the breast, the nipple is pointing at their nose, and rather than coming directly onto the breast like this, their head is actually tipped back. So we've got them close, their head is free to tilt, their body is all in a nice straight line. So we've not laid them on our lap or on a pillow where they're having to turn their head to the side to feed. We've got them facing directly towards our breast. And lastly, we want to position them nose to nipple. So when you bring your baby up to feed, think about positioning yourself, leaning back slightly, have them close, head free, in line, and then just slide them around your body slightly away from the breast. And what that will do is mean that rather than coming at the breast like this, as we slide them around, it's going to encourage the baby to tip their head back and have that nose to nipple position, almost as if a nipple is pointing directly up their nose. You can apply these same principles in any position you feed your baby. So if you hold them in the cradle hold with the same arm as breast, we've got them close, got that arm tucked around, their head is free, so we've not got their head stuck in the crook of our arm, but it's just resting on our wrist. Their body's all in a nice straight line, and we can do that little slide to put them nose to nipple. Same if you're feeding a baby in the football hold. So we've got them close, arms wrapped around. Their head is free, supporting behind their neck. Their body's all in a nice straight line, and then we can do that little slide so that they're nose to nipple.